Hello, my name is Ronnie Smith, Acting Director here at the Ralph H. Johnson VA Medical Center, here to give you another video update of what's happening in our response to COVID. I'm going to let you know what's been happening over the last couple of weeks, and then also go through a few questions that we've had submitted through our Q&A email group that you can see on the screen here. If you have any specific questions or concerns or suggestions on how we can better respond to COVID, please feel free to use that email group and we'll get back to you as soon as possible. First off, I wanted to mention that our ED triage process that we set up here at the main hospital in Charleston has been going quite well. We continue to refine it to make it even better, but that new process is going really well, and it's a great environment to be able to provide triage outside of our ED, make sure that we are providing the best care we possibly can, and make sure we're directing our veterans that need care to the right environment. Based on that success, we're moving forward with also starting to offer more testing at some of our outpatient community-based clinics. We're working to stand that up this week. Also, we'll give you an update. We had discharged our inpatient veteran who had tested positive, and so currently we have no inpatient positive veterans in our facility at this time. And lastly, before we get into the questions, we are working closely with other locations where our veterans are placed, such as our state veterans homes and any contract nursing homes we're working with. We just want to make sure, in case there's a situation where they have a positive veteran or staff or need any kind of support, we're there to support them as well. As part of our community response and knowing our veterans that are at many locations throughout our catchment area, we want to be there to support them as well. So a couple questions. The first one, is there anything that's been set up for people having issues or needing counseling? Yes, we have an employee wellness group that we established, led by Dr. Hall, Huff, and Dr. McDonough. They're providing support to our staff and counseling services. And as always, we have the EAP program available to any staff that are having any stress related to COVID, or want to talk to anyone about what they're experiencing in relation to this crisis. And we're also trying to provide mindfulness moments via all of our communications that we're sending out and in all of our announcements that you hear around the medical center. Second question is, once it begins getting better, will we be moving with the state or with the federal government in relation to reopening services? Because we are a federal entity and we're working in coordination with other VA facilities in their response to COVID, we will be moving as a federal entity in response to looking to reopen any of our outpatient clinics, expanding beyond just emergent, urgent procedural care, because we are in a position where we're often asked to help support other facilities that are having a more extensive number of patients that have tested positive and in need of more resources. So as the situation around the country gets better and the VA is in a better position to be able to serve the entire country of all veterans, we'll be moving as a federal entity and expanding our services. Every service should be preparing for what it needs to be doing to be provide safe care for both our staff and our veterans that would be seeing us as we start opening up more services, but until we can move as a federal entity, we'll continue to maintain our modified operations until then. Next question, and our most popular question, is about our current state of PPE. Happy to report the current amount of supplies we have on hand for all of our main PPE supplies and the hand sanitizer in a better position we've ever had. We have multiple weeks on hand, and our VISN as a whole has even more stored in case it's needed, and in case there's a second wave that's often talked about in relation to COVID. That is a reason why we did modify our masking policy, make it more simple, provide masks on a more routine basis as well, because our supply lines are in a better position than they have been before. The next question is, are we getting MUSC COVID-19 patients or patients from other facilities to care for our VA? VA does have what's called the fourth mission in relation to community support, much like I was talking about when we were talking about working with veterans homes and contract nursing homes around us in our catchment areas. At this time, we have not been asked to support the community in any other ways. There are some other VA facilities throughout the country that have been asked to support other hospitals that have been overwhelmed with the number of patients they are serving, but we're not in that position, and none of the hospitals within VISN 7 are currently in that position. But we are prepared to respond if needed. I do appreciate all the employees that have volunteered to sign up for possible deployment if that opportunity does arise, and I just appreciate everybody's support to thinking about other facilities out there. Then the last question I have is about, in general, about returning to normal around our community. As you know, the governor has asked for the stay-at-home order to continue for 2 more weeks, but there has been some modified allowances for businesses in our communities, such as beaches, boat ramps, and some businesses starting to reopen in a limited capacity. I just want to remind everybody that to continue to keep good social distancing, both in your private life and here at work. Just maintain your safety for yourself and others, and continue to wash your hands regularly. For us moving forward, testing is going to be a critical component for us, and we'll be doing everything we can to expand our testing capability as that becomes available to us. And we'll be following guidance related to expanding operations as it becomes from central office. And the last thing I mentioned is we are continuing to have virtual town halls, and we'll have another one here coming up soon. Last week we had a wonderful virtual town hall with our Community Living Center team. It was wonderful to be able to interact with all of them, being in a zone that's been cordoned off for quite some time and limited from having no visitors. It was a good chance to talk to them, see how they're doing, and especially after all the staff and the veterans on that unit went through testing just as a safeguard. We look forward to having similar town halls with other staff here in the very near future, and looking forward to it. That's all for this session. We'll talk to you again soon.